Hello, Northeast State family, friends, and bears everywhere. Welcome to the Sound Barrier. That's right, Northeast State's official podcast. We're coming to you live today from the Entertainment Technology Studios here at Northeast State in the Tech Building here on the Blountville campus. And I'm going to start first to say thank you to Entertainment Technology, all the fine staff and students who make this podcast happen. And if you're looking for a major, check out Entertainment Technology because a ton of nice equipment. There's some really exciting things happening in the program. Well, where do we start with this episode? COVID. Yep, we've heard that word a lot, haven't we? It seems to permeate every part of our life for the past year, or maybe over a year now. It's affected every way of things we've done, places we can and cannot go, more emphasis on can't go, but it's certainly affected our frontline healthcare workers. That's why today a guest on our show is really, really proud and happy she could join us. Our guest today is Joy McLain, instructor of the Northeast State Nursing Program. She's been on the front line of training a new generation of nurses, some first year, some who were in the middle of clinical rotations when the pandemic hit back in March of 2020. So Joy, welcome to the program. We're really glad to have you here on the Sound Barrier.
Thanks for having me. I
guess we could start out, if you could talk a little bit about yourself, your background, and how you came to teach here at Northeast State.
Sure. So I came to Northeast State after working in healthcare for about 14 years. I have worked in women's health and pediatrics for most of my career. And as a nurse, that allowed me to follow my husband around the world and work in a lot of different locations, including Texas, Tennessee, and even Germany. Oh, wow. And then I came to Northeast State and have really enjoyed the transition with teaching. A lot of a nurse's job got a lot to do with teaching anyway, so it was a very smooth transition, and I've really enjoyed it.
Excellent. Yeah, the nursing program, I believe, started in 2009, and we're pretty proud of it. I'm proud to have instructors like yourself there. Now, in the absolute best of situations, a nursing degree is a very challenging degree to pursue for any student. How has that been, compounded by the pandemic, and how nursing students have kind of had to almost live out a healthcare crisis in real time?
So, I've discussed with a lot of other nurses, and many of them are students that we've had in our program. And I don't want to speak for anyone, but I think I echo their feelings that this has been a real issue. We have all felt some political tension, but for the most part, for us in healthcare, it has still been very tangible. So we have felt the fatigue of the situation. We watched as unit after unit was shut down and then reopened as COVID units. I know one nurse who left her children during the holiday season to care for patients with the virus. Nurses were trained really quickly to respond really quickly, and then how to protect themselves and others was a big part of that transition of care, because we weren't as concerned about family members coming in or visitors, but we had to get very concerned with that. So we would have group chats where people would give shout outs even over text messages to see if we could give messages to family members from that weren't able to come visit their loved ones. So, but the good news is that we are seeing that hospitalizations due to COVID has decreased in the area, and some of the floors are returning to their typical function. So,
like you talked about, they're clearing out some of the COVID wards now. I know the number of positive cases have certainly dropped. We've seen that across across our region, and I guess somewhat across the country. They're still up here and there, but there's a decline as more vaccinations seem to go through and all that. Now, but since you were talking about the healthcare system, it certainly was kind of overwhelmed, and just in so many ways. What have you heard from students in their clinicals about just how they managed going into the hospitals and going into the facilities, and how they kind of coped with the screening and everything that was going on?
So the nurse's biggest challenge is always going to be taking care of the patient first, and even when students are going into their clinical settings, that's that is our main goal, is to make sure that the patients are taken care of. So COVID, of course, presented problems with resources such as our personal protective equipment, and that would be, gloves, gowns, masks, things that usually we would have plenty of resources with. We were running a little bit lower on those. And then equipment. So if you think about respirators, there's actually people in our community who will inventory how many respirators we have in the hospital every single day. And they start making sure that, do we have enough in the area? So we know that our equipment was getting low, our rooms were low, and we had a lot of staff shortages, because of course when your nurses were sick, there were not people there to take care of the patients. So lots of issues and concerns with our students going into those clinical situations. And then there's also the ethical dilemmas that they would come in contact with. Ethically, it felt very strained or very difficult for us to say, no visitors or your family members weren't allowed to be in those hospital rooms. So there was a lot of, issues that sort of bubbled up to the surface with this.
Right. Now, how this pandemic and kind of taking what maybe, for lack of a better term, learned on the fly or learned in the moment, how has this kind of changed healthcare education, specifically, of course, in nursing? How is that going to evolve in the next few years?
There's the academic information, which we will see in our textbooks, such as, COVID-19 disease process, and ultimately what we are using to treat COVID-19. We have drastically improved treatment for COVID with inclusion of convalescent plasma, proning patients, and some of the antiviral medications. And, as a result, we have seen the survival rate in some studies go from 25.6% death rate once they were admitted into the hospital in March of last year, all the way down to 7.6 by this past June, which is a drastic decrease and really shows that we're starting to get a handle on how to treat that. And I think those things will certainly come into our academic realm as we teach students what they need to do to care for these patients. Proning is actually something, it's a positional technique. So typically you would see it in your neonatal intensive care units, where infants would be having difficulty breathing or with their oxygen exchange. And it's really interesting because this isn't something we've ever done for adult patients, and we started doing that. So we are starting to teach different techniques and different things that has come to the forefront. You also have a functional side of healthcare that COVID has shed a lot of light on. So, for instance, FEMA, which is the Federal Emergency Management Agency, is responsible for preparing healthcare teams to work during crisis. And typically these are weather-related, or they may be on a smaller scale epidemic related, so maybe a salmonella outbreak with food. But we have seen this agency in the past year do a much grander scale of care, and so we should be giving a huge shout out to our public health friends, because they've carried a very large load during all of this. But we've been able to see the importance of this training on a much larger scale, so it will be interesting to see, what we've learned from that emergency response to COVID and what challenges that we've faced with it. I don't think that I would be able to tell you exactly how our education is going to change at this point, because we're still working on a lot of it. So we still have a lot of information that's coming in. We have literally seen the scientific method in process, and it's been on the front stage for America to see. So
a pretty exciting thing, too,
yeah,
for as far as hopefully how we handle things coming down the road, of course.
Absolutely.
And what have students told you about their biggest challenge in caring for patients during clinicals, but also maybe graduates who you still are in touch with, or just your own colleagues of nurses? What's been like beyond just the science of it, the connection of the patient?
So I think there's a fear of, bringing stuff home to people's families. I think there's a fear of becoming infected themselves. A lot of our students, they work, and so becoming ill means that they don't have, financial means to keep their, their livelihoods going. So I think certainly there's some fear. There's also a really strong desire to communicate and relate with our patients. And that's hard when you have a mask, a face shield, you're gowned completely up, to get that human connection with your patients. But certainly we've had our students and our nurses in this area have gone above and beyond to make sure that those patients are well taken care of and that they're meeting those emotional needs.
How many nursing students went through this cohort, or just approximately?
Okay, so when COVID hit, that would have been March 2020. We all know that day, right?
Oh, yes. Burned in our brains forever.
But so we had 46 students that were in the cohort to graduate that semester. And so that's 46 students that were going through the program and just about to graduate, and then everything kind of came to a halt. So they're getting ready to, to start their new lives, and everything kind of came to a halt. But they did a great job of being resilient and getting through some of the turmoil. And we actually get information back on, how they've done with like their professional licensing. So, how were they able to perform? Were they able to take the test, get their license, and start on the floor as a registered nurse? And our feedback was that 93% of those students passed their NCLEX, or their National Licensing Board of Accreditation.
Wow.
They
Impressive.
passed that with the first-time test, which is very impressive. They did an amazing job. We're really proud of them.
Oh, definitely. Given all that happened, yes, that is fairly amazing to get 93% pass it through.
Yes.
Now, how did, in March, of course, of last year, clinical shut down? When did students start being allowed to go back into clinical rotations here at some of our partner facilities?
So clinical rotation ceased in March. There was no students that were allowed to go into the units. Now, like I said, a lot of our students work in hospitals already, but for clinical reasons, they were not allowed to go into the hospital. And then we were allowed to get everybody back into the hospital in June of that year, so by the summer.
Okay. Now, were there any students that just said, even second year moving along, they just said, look, I can't do this. This is not what I signed up to do. I don't want to be a nurse. And no, I don't want to do this. Did you have any that?
So the nursing program is a little bit different in that there is some hurdles to even get into the program.
Yes.
So it's usually students who really want to be there, and their ultimate goal is to care for patients. They statistically join nursing because they just care for people. And so I didn't see a whole lot of people who are getting out of the program for that reason. We may have one or two every semester that just decide that nursing wasn't for them, but I didn't see anything out of the ordinary.
Okay, so everybody was very stick with it. Dedication is a big thing in the nursing
We have a really
field.
good dedicated group of students. So
now, where do nurses go for support after a 12+ hour shift 3 days in a row, and they go home to their families, and of course you got the responsibilities there, but where did nurses go to get their own emotional and mental support?
So we do a really good job of turning to each other. So most of nurses have nursing friends that they are able to call on and rely on for, just help emotionally. The state of Tennessee has also put out a COVID emotional support line, so they're able to contact them. And then there's also Ballad Health has an emotional support set up for their employees to make sure that everybody is being taken care of.
Okay, cool.
It's interesting that you said that, though, because there are a lot of psychiatric diagnoses that are coming about with specifications to COVID. So, COVID crisis fatigue or something I don't know exactly if that's the wording, but they will show up in our DSM 6, which is, the list of all of our psychiatric diagnoses, they will come up with the next edition. So.
Oh, wow. Yeah. The trauma, I don't think we're even starting to understand the trauma of all this. We may not for several years, but I don't know.
Absolutely.
You see the nurses, and I guess just from experience with family members, the nurse is kind of the lifeline to the whole care, or at least that's what my observation experience of it has been.
We think we are. We think very highly of ourselves.
Well, yeah, and with you have every right to.
We really enjoy taking care of our patients. We love being involved.
What are things pandemic related that nursing education may incorporate in the next few years based on the experience we have now?
Well, like I said, I really do think that they'll start incorporating more emergency preparedness. So even though, FEMA's been around forever, and there are certainly lots of people in the community that's trained for that, for everyone to be on the same page during a large-scale crisis will be really important. And so I think that we will see some more incorporation of that in our educational programs.
Okay. You also mentioned the public health sector. Nurses have, it's not just hospitals and doctors' offices. Nurses have a pretty wide career scope that they can go into for people who need nurses, be it public health systems. I know the military is open for nurses as well. Can you talk a little bit about some of the career opportunities that are out there for nursing?
Okay, so that is a loaded question because I don't.
Let's not name names.
We have a lot of different avenues. So myself, I went into women's health and pediatric, but certainly there's all these different specialties that you see in the hospital. You also see public health nurses who are, right now at Bristol Motor Speedway giving vaccinations. You also have nurses who do mostly case management. So all of these patients that are in the hospital, or sometimes patients that were just sent home, have case managers who are nurses who will make sure that they're following through with doctor's appointments. The objective is to keep the patient out of the hospital. So you have lots of people who go into that trying to meet that objective. You also have home health nurses, so nurses who go into the homes of these patients and try to take care of. Home health is really interesting, actually, because you have a view of what your patient is actually doing, what they're actually seeing. So when you go into a diabetic's household and they've been telling you, I've been sticking with my diet and things have been going well, and then they say, my doctor's allowed me one Diet Coke, and you say, okay, that's fine, and you see that they're putting maybe 10 teaspoons of sugar into the Diet Coke, then you're able to address,
oh dear,
that's, this is the reason your blood sugar is running high. So home health nurses out there. You also have, you even have Ask a Nurse, where you're literally at home and you're just sort of discussing phone calls with patients to try to make sure that they're being cared for. You talked about the military nurses. I actually was able to contract with the military, and it's really neat to see what all they're doing, because they have people downrange, and they're able to stick a stethoscope on a patient, and the doctor or the physician that's in the clinic, not downrange, is able to listen and be able to diagnose and treat the patients from, I don't know where exactly they are. Sometimes they're in Germany, sometimes they're in stateside. So
right, it just takes a nurse can really adapt to a lot of different, I guess, care settings, you could say, because it's a very diverse way in which care is delivered now, as opposed to maybe in years past. Now, I know we do know about one student that was able to receive a grant to kind of stay in the program. If you want to talk a little bit about that, that's kind of an interesting story as well.
Absolutely. So we try to make sure that all of our students know about the CARES Act, because it is a way that they can maybe tap into some resources. And during this time, we had one of our students who was able to apply for a grant, and she was granted financial assistance that would get her through the program. It would it even is going to pay for like her testing, so her board testing. And so we have a lot of students who, if they're single, if they have kids, if they're already working, that really provided them the ability to focus on completion.
Oh, nice.
Yeah.
Well, it's a really good thing for her. Now, I'm also told that we have a couple of new teaching tools there. The nursing program is housed, by the way, in the Regional Center for Health Professions there in Kingsport, on the Northeast State at Kingsport campus. And I understand we've got a couple of new teaching tools. One is a little newer than the other, but if you want to talk about either one of those and kind of explain how they work.
Okay, so, I'll back up just a little bit to say that, during the COVID process, we had to become a little more, we had to become really flexible with how we were teaching our students, and we needed new innovative ways to be able to make sure that these students were prepared to go up and care for patients on the floor. We started using virtual simulation, which is a computerized program, and it tests students on clinical decision making and action-based click fields, or through action-based clicked fields, as well as fill-in-the-blank answers. And literally, the patient communicates their needs and their health condition and their vital signs, and the information that you need to care for the patient comes up as the student is working through the patient's care. So the patient will get worse or better depending on students' answers. While that was great and our students could do that on the computer, what was really awesome is that we were able to get a simulation man, to bring into our actual lab. And again, our students are able to input information into what they would actually do in a particular situation. So if the patient needed an IV, an intravenous catheter, then they could do that, and then the simulation man would respond appropriately. So he may say, "Ouch, you stuck me," or
wow,
yeah,
crazy.
So lots of different stuff. They can do, the sim man can do heavy breathing, so the students can listen to their lung fields. They can listen to cardiac rhythms. They're able to, sometimes our nursing instructors can play around and, make our sim man go to a downward spiral just to see what students are doing during their crisis modes.
Interesting.
Yeah, and so if they're not treated appropriately, though, we would see that the patient digresses with that virtual simulation. We also have we have had a birthing mannequin for quite some time, but we got a new one that you're actually able to do pelvic exams with, which is really important when you're talking about labor and delivery. And so it's been really good to be able to incorporate those things into our office, because students need that hands-on experience, and they need to be able to walk through it without maybe, jeopardizing an actual patient.
Right. Oh, yes. I don't want live people in there.
Yes.
But now, for every like encounter with Simulation Man, is all that data captured in like a file that, this happened and his blood pressure went to this, or?
So I'm not sure if it like records anything, but our instructors are sitting there, and we're able to sort of
monitor the whole
gauge
event.
What's going on, and be able to say what maybe they need to have an intervention.
Yes.
So
what in, just from your experience and what you do, what makes a good nurse, or what gets you from the first day of nursing school to passing the board exam and getting that RN and becoming a nurse? What
okay.
makes that
So
happen?
first, I would start with how do you get through nursing school? 'Cause
Yes.
that's a big one. Like I said, just getting into nursing school, there are plenty of hurdles to jump. But then once you get in there, you see there's some key elements that really facilitate achievement for our students. One of them is that they're a cohort. So they go through all of their courses together. They are aligned together. So when they're doing a medical surgical and maybe they're doing a mental health class, they're all in those same classes together. This helps with that relationship. And I already talked about, nurses really depend on other nurses for that emotional support. Well, our nursing students certainly depend on each other for emotional support as well. And then they're also able to make like study groups. So one of our key things that we really try to emphasize with our students is get into a study group. And it's really interesting to see the grades when, they're sort of floating along and then they join a study group and you really see that improvement on their grades and what they're actually comprehending and able to grasp. And then also students who take advantage of, coming in and discussing things after hours with their instructors, that really helps to get the student beyond the classroom, to help them understanding some of the analysis of our exams or of their time at clinical. So we really see a big improvement with those students who take advantage of coming in and talking to the instructors when they have an opportunity to do so. And then what makes a good nurse? The number one thing is to care, and you can't teach people to care. That is something that, even if you're not great at it, when you first start nursing, you sort of learn how to do so. So how not to be judgmental, how not to jump to conclusions. And I think, like I said, after 14 years of nursing, that's something I can even see in my journey is how much better I can care for a patient. You can't teach that, and you can't teach somebody that if something's going on with someone and you just don't know what's going on, you need to go to the next person who could.
Right.
And that takes effort and that takes time, but you're really good nurses. You see them do that.
Truly, yeah. That's a good observation. Joy, we have come to the 3-question rapid fire response.
Okay,
Are you ready for
nervous. It? Yeah.
No. It's 3 quick questions, rapid fire. They're pretty simple. If you want to elaborate on your answers, please do so.
Okay.
Are you ready?
I think so.
Question number 1: Netflix or Amazon Prime?
Hulu.
Oh wow. Okay.
I've really gotten into Hulu, and the fact that I can fast forward through some of the commercials now is really nice too. And also you have what's the YouTube TV. I like that one a lot
YouTube
too.
TV is very, very sweet.
That is nice,
Yes.
right?
Oh yes.
Okay, so that's my answer.
Hulu. Okay.
Hulu and YouTube TV.
All right. Cool. All right. Question number 2:
Okay.
Mocha or pumpkin spice?
Oh, that depends on the season, but I'm going to go with pumpkin spice. I'm that girl.
It's a fall. Hey, pumpkin spice is beloved around the world. Pumpkin spice. All right. Question number 3. Now this might be a bit off, but it's kind of been in the news too. But I ask this one a lot because it's just of interest. Mars Rover or Falcon 9?
Mars Rover.
Mars Rover.
I want to see what's on there. I want to see what's going on. Yes.
Yeah, it's pretty exciting to see
Agreed.
land, and like it's got the drone now that can fly around, which is amazing.
Yeah.
Okay, Mars
That's my
Rover.
answer.
All right. Yeah. Well, no love for Elon Musk this time, but maybe next time. Anyway, Joy, we have come to the end of this episode, but can't thank you enough for coming out here and being on the Sound Barrier. We appreciate it more than you know.
Thank you. This has been a really cool experience. I've loved getting to tour the place and see what y'all are doing here.
Oh yeah, it's exciting. We've got big things happening here. Big things happening. But again, we're glad to have you here and glad you joined us today.
Thank you.
Well, that's it, friends and fellow bears. Another Sound Barrier episode in the books. As you come to this episode, make sure you check out this episode and all the great episodes we've done so far at thesoundbarrier.com or thesoundbarrier.net. And when you get there, either one of those websites, just smash that old subscribe button and you can listen to us on any Apple Podcasts, Google Podcasts, iHeartRadio, Overcast, Stitcher, any of those channels. We're out there, even Pandora and Spotify. Yes, you can find us on Spotify. Again, that's thesoundbarrier.com. And you could always check out Northeast State Community College at northeaststate.edu. Again, that's northeaststate.edu. So that's it, friends. That's all we have for this episode of The Sound Barrier. And until next time, take care.